Who is eligible for chemotherapy and lymphoma treatment? When it comes to chemotherapy for lymphoma, particularly non-Hodgkin lymphoma, several important factors determine eligibility. Chemotherapy is a common treatment for many types of non-Hodgkin lymphoma and can be used alone or alongside other therapies like immunotherapy or radiation. First, the diagnosis and subtype of lymphoma play a crucial role. Chemotherapy is often recommended for patients with aggressive or advanced stage non-Hodgkin lymphoma. In contrast, some slower-growing lymphomas may not requiring immediate treatment and can be monitored unless symptoms arise or the disease progresses. Next, the stage of the disease and its burden on the patient is significant. Individuals with widespread or bulky disease, or those experiencing symptoms such as fever, weight loss, or night sweats, also known as B symptoms, are typically considered for chemotherapy. This treatment can help manage both the disease and these distressing symptoms. Another key factor is the patient's performance status, which reflects their general health and ability to handle treatment. Performance status is often assessed using scales like the Eastern Cooperative Oncology Group score. Patients with a good performance status, meaning they are fully active or only slightly limited in physical activity, are more likely to be eligible for chemotherapy, as they can better tolerate its side effects. Organ function and any existing health conditions, known as comorbidities, are also critical. For chemotherapy to be safely administered, the heart, liver, kidney, and bone marrow must function adequately. If there are significant health issues or organ dysfunction, this may limit eligibility or necessitate adjustments to the treatment plan. Additionally, the history of prior treatments is taken into account. Patients who have not undergone chemotherapy before, or those whose disease has returned after initial treatments, may be candidates for chemotherapy. This could also involve newer medications or stem cell transplants. Lastly, it is essential to rule out any contraindications. Active infections, severe immunosuppression, or other medical conditions that could increase the risk of toxicity must be considered before starting treatment. In practice, a team of healthcare professionals evaluates all these factors through detailed clinical assessments, laboratory tests, imaging studies, and sometimes biopsies. The aim is to weigh the potential benefits of chemotherapy against the risks of side effects, tailoring treatment to each patient's unique situation. In summary, eligibility for chemotherapy in non-Hodgkin lymphoma hinges on a confirmed diagnosis, the appropriate disease stage, a good performance status, adequate organ function, and the absence of contraindications. Patients should always consult their oncology team for personalized assessment and recommendations.